So clinicals of the superficial veins include three major clinicals, that is the great saphenous vein cut down, thrombophlebitis, and varicose veins. Let's start with the great saphenous vein cut down. This procedure is carried out in conditions in which rest of the superficial veins of the body are collapsed as a result of dehydration, as a result of injury in which a patient may lose excessive blood, and sometimes in heart attacks, cardiac arrests, the patient may experience low blood pressure. So all of these conditions, they lead to the uh, uh, collapse of veins, especially superficial veins in whole of the body. So in order to build up the blood pressure of the patients, it is one of the common procedures carried out in the emergency rooms by the doctors, on-duty doctors. And what happens in this procedure? Why do we choose a great saphenous vein for this procedure? Because great saphenous vein is easily accessible with constant location just above and anterior to the medial malleolus. So as well as in the groin region, inferior and lateral to the pubic tubercle. So great saphenous vein can be reached at two sites, in the groin, below and lateral to pubic tubercle, and at ankle, above and medial to anterior and above to the medial malleolus. So what actually happens at the ankle, if we access or if we reach the great saphenous vein at the region of ankle, what you do, you make a transverse incision just above, superior and anterior to medial malleolus. And then you make a transverse cut in the skin, and that will just lead you in the superficial fascia to the great saphenous vein. At this region, the nerve that should be preserved and saved is the saphenous nerve. And this nerve, before starting the procedure, is blocked by giving an local anesthetic agent. When you access the great saphenous vein in the region of groin, you can reach the saphenous vein by two approaches. Number one, by palpating the pubic tubercle and moving down and lateral to it 1.5 inches. You can again make a transverse incision to 1.5 inches below and lateral to pubic tubercle. The second approach is that you can go for the palpation of the pulse of femoral artery. And once you palpate the femoral artery, you can make a transverse incision just medial to the pulsation of femoral artery. Both of these approaches will lead you to the great saphenous vein. In this region, the nerves that should be preserved include the ilioinguinal nerves and the intermediate cutaneous nerve of thigh, which are providing the cutaneous innervation to this region, upper medial aspect of the thigh. Ankle venous cut down is commonly done, but it is again commonly associated with a complication which is called phlebitis, which is actually the inflammation of the venous wall. This complication is rarely associated and rarely observed when the saphenous vein is approached in the groin. Next very famous clinical associated with the superficial veins of the lower limb is the thrombophlebitis. Thrombophlebitis is a condition having two components. Inflammation of the vein wall associated with the development of the thrombus. The complication that is associated with this clinical condition is the pulmonary embolism, which happens if a blood clot detaches itself from the venous wall, wanders through enters the blood circulation and reaches the lungs through the circulation, venous circulation especially. It may reach the lungs and may lead to the blockade of the vasculature of the lungs, leading to the development of the condition called pulmonary embolism and further causing the complications. Next, we have varicose veins. Varicose veins, as we did yesterday, varicose means dilated, swollen, superficial veins. which become tortuous and visible on the surface of the lower limb. The causes include incompetent veins in the perforators that connect the superficial veins with the deep veins. And because of their incompetency, the unidirectional blood flow from the superficial veins to the deep veins is reversed from deep to superficial. The causes leading to the incompetency of the valves include obesity, pregnancy, aging, familial history, use of oral contraceptives, and prolonged hours of standing. What happens when a lot of pressure is put on the valves, leading to their increased prolonged stretching, ultimately causing and making them incompetent? What happens? Pooling of the blood starts within the superficial veins and deep veins of the lower limb, and further backflow of the lower limbs leads to the further distension of the veins of the lower limb. And ultimately, the superficial veins of the lower limb, they become so much engorged with the pooling of blood in them that they swell up and appear and become visible on the surface of the lower limbs.